Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
Hello and welcome back to the DNA podcast. I'm Cheryl, Hickey, TV host and media personality. Now, of course, we will be unlocking the code of your genetics together with Bryce, Wylde, co-founder and chief innovation officer of the DNA company. How you doing, Bryce?
I'm really good. Cheryl, how are you feeling about today's topic?
I'm excited to talk about this. I think this is going to help a lot of people. Yeah.
I am too, so much. This is one of those conversations that hits really close to home for a lot of people, including myself. I've got a family riddled with mental health challenges and addictions. So I'm patient one today, perhaps. We're not just talking about science today. We're talking about the lives that could have been saved. And I'm very excited to have Dr. Tiffany Smith with us. To dive deep into the behavioral patterns that often go unnoticed. Dr. Smith's actually an integrative and functional psychiatric nurse practitioner. Sounds like a mouthful, but she's the go-to when we're talking about these types of dilemmas, and also the founder of Aroma Functional Nutrition Psychiatry. And with a very unique approach that blends functional medicine, aromatherapy, and personalized care, Dr. Smith individually breaks free her patients and her clients from the constraints of traditional mental health treatments. And inspired by her own personal journey of helping her husband overcome chronic health challenges, we'll hear about that today. Dr. Smith empowers her patients to achieve lasting wellness, going beyond medication to create vibrant, fulfilling lives. And today she'll share insights on mental health, addiction, and the holistic strategies she uses to heal from within. And I should mention, she's also one of our very proud clinician partners. Dr. Smith, welcome to DNA Talks.
Thank you so much for having me. I'm so glad to be here, and I'm really hoping that everyone hears our message and we can change lives today with this message.
That's agenda number one. In fact, that's probably our only agenda. So, of course, we'll get into some of the nuances of genomic screening, perhaps talk about our own individual plights. But first and foremost, it's really hoping that individuals out there understand that there's a place to go for solutions. And I don't just mean your personal clinical practice or what we have to offer the DNA company, but there are solutions out there when people are struggling and suffering, and that they should not feel alone.
Absolutely. First of all, do you want to, Dr. Smith, tell us a little bit about yourself?
Okay. Well, I am an Aries, born and raised in St. Louis, Missouri, currently residing in Las Vegas, Nevada. And I've been here for 21 years, just needing change. And I have been in nursing since 1996. And in my journey, I've experienced a lot of different areas of healthcare, but I was working in a crisis stabilization unit as a nurse. And it reminded me, it flooded back to me all of the memories about mental health care, my curiosity around that, and how they said that there's a revolving door in mental health care. And I'm like, why? Why is there a revolving door? And that's when I decided to go back to school, become a nurse practitioner, get my doctorate. Then, after doing all of that, I did realize that I don't want to be a pill pusher in our healthcare system. There's more that needs to be done here. And so I got additional education around integrative and functional healthcare. And so, but all of that came about because of my husband and his journey. So while both of us, our families are healthy, they live to 100 plus, we don't see much of the healthcare system. However, and he's also a nurse as well, and was a combat medic in the LPN and nurse in the military, and has been to Desert Storm, Desert Shield. So when we needed to lean in the healthcare system because he started having chronic pain that became so debilitating, we're leaning in the healthcare system, and we're just giving pills and potions and things. And after like decades and a half has gone by, our quality of life isn't any better, and he's basically bedbound from this pain. Or what he gets gives him side effects like sleep. So he's not engaged. He's out of pain, but he's not engaged in his life. And we're looking at our lives and where we are, and it's like, where are the walks in the beach? Where's the Disneyland trip with our life being like this. We're doing what we thought we should do by leaning into our healthcare system because that is where we thought we would get healthy. And so we soon
Right.
learned what the healthcare system's purpose is and what our role is in our health and wellness. And so that changed our
Mm.
trajectory. So my company is named Aroma Functional Nutrition Psychiatry because these are modalities that I use that helped my husband. So my husband said, forget all of this Western medicine. Forget the pills, the injections, the creams, the lotions, all that stuff. And we got to find something else. Now, that's the thing. We never knew what the something else was because we knew we never really wanted to take pills or, and be in that type of healthcare practice. So we didn't know what we were going to do. And so we had to be open to the universe, put that out there, and wait for the response. And aromatherapy was the first thing that came our way that we thought would be an option. However, no one really could
Mm.
direct or tell me how to use essential oils, right? It's just put this here, throw that on, smell this, put this on you.
That's
Wait a
right.
minute, wait a minute, wait a minute, wait a minute. What are the precautions around this? Just because it's something natural from a plant doesn't mean you can just use it willy
It's
nilly.
safe for everyone. That's right. Yeah.
Exactly. So I went to school and I got a diploma in aromatherapy. And then through that, I created different case studies, different blends for my husband. And before you know it, he started getting up and out the bed and was pain free. And it became for longer and longer stints. Okay, so now the fire is out because the fire was the pain. Now let's get
Right.
back into our lives. Now, what do we do next? Now we're looking at lifestyle, we're looking at nutrition, we're looking at exercise, we're looking at everything that we do so we don't ever have to get back there. And that's when
Right.
functional medicine, functional nutrition, all of these holistic things started to come my way that I had never been exposed to before. And I advanced my education in there. So while I'm working with him, I'm also a nurse practitioner. And in my practice, I'm hearing the same parallels to what we were going through. And now I'm like, you know what? I need to create a practice and put everything that we're learning into this practice so we can help more people more holistically. Because our healthcare system is only teaching us pills, therapy. It's so much more to us. There's so much more
It's
we can
very
do for our
reactive, right? It's very
right.
reactive.
And there's so
Yeah.
much more we can do to help and better ourselves. We just need to know that. And so my goal is to empower. I'm a DIYer and I love to empower. I want to help people do everything they can for themselves. And then after all else fails, I got your back, you know? And so that's my goal. And that's what brings me here today.
I really love that. My sister is a behavioral support nurse in long-term care.
Hmm.
And about 2 or 3 years ago, they started implementing some aromatherapy to help with some of the anxieties and some of the things that the patients were going through. And I
Hmm.
remember her sitting down with us, my mother and I, and explaining some of the remarkable things that they were seeing with the residents. And it was
Hmm.
really spectacular. So I truly do believe, and I know Bryce does as well, it's not just one thing. When
No,
someone's
Right.
not well, it's not just one thing. It's a
no.
group, there's a root cause, then there's environment, then there is everything else
Lifestyle.
around it. And I
Hmm.
love that you're looking at people from a 360 perspective, right, Bryce?
And I got
Hmm.
to say, holistic medicine appreciates N of one, which means essentially the individual, personalized medicine, which, of
Right.
course, at the DNA company, we hold in highest regard. But here's really what set a little aha moment off for me there, this light bulb, which is when, I mean, there's so much to unpack there and so amazing to hear the outcome, positive outcome with your husband, of course. But when you said it was essentially aromatherapy that turned on the proverbial bulb with him,
Hmm.
that struck a chord with me because that's really one of the least, I suppose, scientifically revered, although I fully, as Cheryl does
Mhm.
as well, believe in and or use it myself. And I think people often feel well, there's two things here. The first thing I would suggest is, again, to that point of personalization, it's what worked for
Hmm.
him, and there's a
That's right.
solution for everybody,
Hmm.
and it's not always the pill. The second thing is that often we're always playing catch up with, innovations of thousands of years old, of which aromatherapy is. This is not
It's
new.
true.
and it's not
Correct.
hokey. The olfactory bulb, as you know well, I'll just explain this real top line, has a direct pathway to the brain. It's
Mm-hmm.
located at the base of the brain. It's directly responsible for smelling things. And unlike
Yes.
other sensory inputs, all like our eyes, which have to pass through this area in the brain called the thalamus, the olfactory
Right.
bulb has this very direct connection to the brain
Mm-hmm.
that regulates emotion and memory and the amygdala and the hippocampus. So we all know that sensation of coffee first thing in the morning and
Yeah.
memories of good things, or the
Right.
smell of pine trees and being at the cottage. So this makes scent one of the most potent triggers for emotional and psychological responses, right? I mean,
Yes.
this was just, I've never imagined something to be such a trigger, but this worked for your husband, and it
Yes.
could work for other people as well.
Yeah.
Very much so. Very much so.
And I think, with you sharing this story, this is so important. And there are so many people who are sharing their stories of addiction. There's people sharing their stories of depression. And this is me trying to transition into a story that everybody has been talking about, and that is a beloved actor that we all know and have watched for many, many years, which is Matthew Perry. He was best known for his quick Canadian comedic chops, and also for his love of helping other people. Now, sadly, his untimely death opened up the doors for a much bigger conversation around addiction, depression, and hope. So I'm going to go back a little bit just to talk about Matthew's backstory, because I think it's important as we move forward and we talk about patterns in life. So just bear with me here. Matthew landed the role of Chandler Bing in 1994 off of Friends. He and the cast were absolutely everywhere. So think of the pressure with that. Eventually, at one point, he was making $1 million an episode. So while that's exciting, that's also you're firing and wiring all kinds of things in your brain for a long time on a big scale. So behind the scenes, Matthew confessed he suffered from alcoholism. So this addiction then advanced to drugs. In 1997, he suffered a pretty severe jet ski accident and was prescribed Vicodin for pain. According to People magazine, he was doing 20 to 30 pills a day, and he entered into rehab, and that was in 1999. So people quoted him as actually saying, "It wasn't my intention to have a problem with it. From the start, I liked the way it made me feel and I wanted to get more." So jump to 2000, 2001, there was a hospitalization for pancreatitis, which is a potentially deadly inflammation, multiple rehab stints to recover from addictions and opioids and amphetamines and alcohol. So then in 2010, he went very public, which again is incredibly brave, about his addiction, and became a real advocate for rehabilitation, speaking about the long term effects of his addiction and the effects it had on him, including gastrointestinal problems. He even converted his Malibu mansion into a sober living house for others, underscoring his real commitment to helping others, not just taking care of himself. He even won a Phoenix Rising Awards for helping others with addiction. This is how big this man's heart was. In 2018, he had another scare where he faced serious health issues related to addiction, including gastrointestinal perforation that required emergency surgery. Now, in 2023, he slipped back into addiction and he died on October 28th in his home. The exact cause of death is still being investigated, but initial cause of death was from overdose of ketamine. So
Well,
it strikes me, like
heartbreaking.
you look at this entire story and you see where he kept trying to get back. He kept trying to get on an even keel. And in 2002, I'll go back again in his memoir. He had a memoir called Friends, Lovers, and Big Terrible Things. He stated he battled with depression for many, many years. So I want to ask you this, Dr. Smith. Let's start with understanding the genetics and emotional aspects of depression. Can you talk a little bit about that?
All right. Well, I'll leave Bryce on the genetics piece. I'll kind of go over it just a little bit. You can go deeper, Bryce. Genetics in relation to depression and anxiety. I think that is very significant. As a mental health provider, we all take a family history. We all recognize that people can have genetics. But what I love about the DNA 360 test and understanding how that brain works, not just that mom, dad, cousin, sister, but understanding how your brain recycles and creates and utilizes your dopamine and serotonin and all of those things is so significant in creating that treatment plan, the proper treatment plan, and understanding that person uh, for depression, anxiety, any mood issues. Um, it is such a blessing to have functional genomics in a mental health practice. So typically, you come to see a psychiatrist, you know you're going to be put on some pills, and then you go about your way, and maybe the other option is counseling. Or if you go into rehab for substance use disorder, it may be basically with just abstinence. But nowhere are we really getting that full comprehensive mental health care. So with depression and particularly um, and mental health care and genetics, we're looking at behaviors, family members, we're looking at those behaviors, we're looking at isolation, withdrawal, we're looking at anything that is, let's say this, memory issues, low energy, lack of interest in things that used to be interesting and pleasurable. These are the symptoms we're looking at when we're looking at depression. That should strike you like, you know what, you used to love fishing. How come you haven't been fishing this season? You know, this is your
Mm.
favorite show. You're not laughing like you used to. We used to crack up on this. This was our thing. That's what you want to start kind of cluing on. When it comes to addiction, you're looking at things like people chasing that high. So, like with genetics, understanding that maybe they clear the dopamine really quickly, so they're chasing the high. I felt really good on on this pill, on this Vicodin. I wanted to feel that way. So you're chasing that high. From a provider perspective, someone might go through their prescription really quickly. So you may have 6 days of pills, you've gone through it in 2 or 3. You may be aggressive or agitated when we talk about decreasing the pills. Maybe you want to increase, you want more frequency, and the provider, you've already given out this is the prescription and how it should go. So those are things that you'll see within genetics. You're going to see either there's not enough neurotransmitters, they're getting cleared too quickly, or they're not being. Well, go ahead, Bryce. Back me up here. I'm losing one component. Created
Oh,
too.
you're doing too well for me to back you up. You're doing excellent.
You're either not
You
making
know,
enough. It's like you're not making enough. You're making too much. There isn't any there, or it's not being picked up, or it's being picked up too quickly. So it's just this, and that's where when we talk about functional, we're looking for that dysfunction within the
So
individual, and
that's
that's
why
the
that's so important to know, I would assume.
yeah.
If someone's ripping through things, is that a telltale that something in the genetics or the genomics of that would be helpful to know?
Correct. Because if you're clearing out your dopamine, you're chasing the high. So now we know what the root cause is. Now we know how to approach it. And now we can
Okay.
figure out how to normalize those neurotransmitters so that now you're not chasing it anymore. Now we have what we need. See, the diagnosis isn't the end. The diagnosis is the beginning. And then when we do things like the functional genomics and other functional testing, now we're understanding at the cellular level, the genetic level. Now we can create that plan that's actually going to give you help.
So, can I ask
right.
this question? Is there a connection between addiction and depression? And can it coincide with mental health conditions and complications?
There's definitely a connection. So think of depression like this. Why do people get depressed? You have genetics, meaning that they could be predisposed. But a lot of what I see is past traumas that are unresolved or
Hmm.
currently occurring or certain voids that haven't been addressed. And people are looking for a way to fill that. So you might find, in a healthy, positive perspective, avid runners, cyclists, some people that really get involved in their music and their art. This is the way that they are, in a positive way, filling those voids. But some people the
Okay.
influence might come from drugs and alcohol, a way to numb and
Okay.
escape. And so that's where, it can lead to the depression can lead to the addiction. The addiction also though may make you feel more in despair, more helpless versus eliminating and making you feel high and pleasant at times as well.
Okay.
I was just going to say, and just to be, just echo and almost maybe summarize to some degree exactly what Dr. Smith is saying here. Addiction is almost from my clinical experience, and again, my family experience is very close to home, never just about the substance or even just about the genes or the neurotransmitters or just the environment. It's about all of it and the emotional pain, the trauma, and often the people around the individual. And we'll talk about this, I think, who may unintentionally enable the destructive
Mm-hmm.
behavior. So with somebody like Matthew Perry, I think we can imagine that his struggle, I wasn't there, I don't know, but wasn't just about the alcohol, the painkillers. It was about a deeper emotional scars. And I think where this gets
Yeah.
complex and in very nuanced, and of course, genomics sets the stage. We call this often the gun. The environment pulls the trigger. It's a
Mm-hmm.
very maybe inappropriate
Right.
analogy in context of
Yeah.
what we're talking about, but at the same time, it's very visual and it depicts this very sort of hardwired scenario where we have this combination of the two. And I'm happy to explain genetics in a more unpacked manner if we have the time. But I think we'll eventually get into this. The enablers around somebody struggling with addiction often don't even realize they're part of the problem. And I was just going to mention and sort of and there that I was personally, besides what I experienced in my own family, I had a couple of sisters with addictions. My father had challenges with bipolar, two uncles with schizophrenia, cousin that committed suicide. So I've been around the block in my own family with this stuff, but
Right.
I was very disturbed and brokenhearted over seeing the struggles of Anthony Bourdain and even Robin Williams. And Cheryl, you've seen this in public figures over the years as well. I mean, what do you think?
Well, even in our family, my dad had progressive supranuclear palsy, and before we had the actual diagnosis, there were different behavior things that were happening. And he would have a couple of drinks and we were like, he doesn't normally even drink. Like this is not, and to my point is there was something more going on that we didn't know. And those are the things that I think, that families really struggle with later, right? They're like, well, we didn't know. And if you don't know, how can you help? And I know, and just the things that I read, Matthew's parents were very involved and did everything that they could. And so a family's intervention is only one, as you say, it's one piece. There's so many other pieces to it, right? And in this case, and in I'm sure in the case of your family, Bryce, you realize when you step back, it's like hindsight's 2020, and understanding the importance of all these pieces, right? The genetics, the trauma, the alcohol itself, or whatever the drug of choice is. It's such a bigger picture thing. It's not just one thing, right?
Absolutely. And
Um,
Dr. Smith hit on something so important too, is, and it reminds me of a friend of the company, the friend of the DNA company has his own story to share. And actually it was Matt Damon that produced his Netflix special. His name is Charlie Engel. And I just got to tell a story real quick because Dr. Smith just said something about how addictions can be substance abuse or even for that matter, running. And we can describe that through genetics. But Charlie's story is very powerful. It's an example of how addiction and mental health struggles can be transformed into these positive life changes, especially
mhm.
when you connect with somebody like Dr. Smith. So there's my shameless plug with, you and what you do, Dr. Smith. But, and again, this N of one personalized, how these things, can transform and people can wake up even with something so maybe benign and inert as or it's not inert at all, but aromatherapy, but certainly the choice of what would work for the person. But this guy, Charlie, was known for his extreme endurance running. But his journey started in a really very dark place, addicted to every drug on the planet, alcohol. He was actually shot up at one point, literally by police that were banging down his door, nearly died. But for years, he battled substance abuse. But his turning point came when he realized that he could channel the same obsessive energy that fueled his addiction into something constructive, and that was running. So it's become his new drug, but it's a positive drug. And I just wanted to sort of, again, reiterate how that is such an important thing for a lot of people to hear, because even if you have certain genes that dictate more predisposition to addictions, that's not it's not a bad thing. It's like ADHD, which can be a superpower. You can
Oh my
turn
gosh,
the
I know
switch.
so many people, it's their superpower. And
Mm-hmm.
I watched it, I'm like, you're amazing. So you're right. I think that's a really important message for people to understand. Just because it shows up in your test or it shows that you have this, it doesn't mean something terrible is going to happen.
Right.
It can be used. But I want to go back to Dr. Smith, and how does an integrative and functional approach to psychiatry differ from a traditional mental health treatment, particularly in addressing depression and addiction?
So when you think about going to see a psychiatrist, you're having mental health challenges. You know, when you're going to see a psychiatrist or a psychiatric nurse practitioner, the end result is you're going to walk out with some scripts,
Mhm.
flat out. You know that's going to happen. And so when people come to me, they're often feeling very broken, feeling like I've tried what I could try and did what I can do. So now I'm giving up and I'm willing to take a pill. And then there's pill and then there's therapy, you know. And you just, because they feel that there aren't other things that can be done. And that's what our health system makes it sounds like and appears. While in therapy, there are a few other, it's a little bit more spice and jazz there when you're talking about brain chemistry and really getting that medical provider. Pills is what's offered. And so I felt that there needed to be more than that. When you learn about pills and medication, you learn about how they affect the body and the side effects and all of the negative things that come with that. You don't even talk about how hard it can be to stop taking the medication, the withdrawal from these
Mhm.
medications. We have to really be serious about, do you really need this? So
Mhm.
that's the thing. When you come into our current healthcare system, it's pills and therapy. But there's so much more that is involved in healthcare. Healthcare, our mental health, it's a whole person care system because everything starts with our thoughts. Then our thoughts become beliefs and behaviors. So our mental health has to take into account your mindset. It has to take into account your overall physical and mental health because the brain and body are connected. Your lifestyle, your genetics, your work,
Yes.
your environment. So I often go into conversations about, you know, identifying those things in your life that are uplifting you and supporting you, and those things that are are not, And first thing, get rid of those things that are not supporting your mental health and well-being.
Mm.
And sometimes
Mm.
it's giving that strength around being able to do that. I get people that their number one struggle is life navigation. It's just that you're,
Especially with our younger generation, Dr. Smith, it is so
yes,
big.
it
It
is
really is.
huge. I love to talk about the 90s. Let's go back for a second. The
I
90s,
love the 90s. The
I love
music
the
was good. The clothes were good. Sorry. Sorry.
I
Okay.
love the
Yes.
90s too.
Okay.
I'm with you. So you got the energy for me. Let me paint the
We're
picture.
all there.
It's the 90s, right? Wellness is built into our lives. Sundays, nobody worked. Families got
Yes.
together. You cooked together.
Yes.
You'd be outside in the yard playing together. You had community. Remember, we used to have the diaries with the little locks on them, and you put them under the bed.
Yes. I just got one for my daughter, Dr. Smith. Those are so important. Oh my goodness. I love where you're
It was
going with
right next
this.
to my pet rock and also my
Yes.
my chia seed, grower
Yeah.
thingamajigger.
All right.
It
What about this?
matters.
Come home, take off your school clothes, and put your play clothes on. We were in
Mm.
nature
You're right.
naturally. So we were already in nature. We were journaling. We had community. We were eating together. Food was medicine. It was love. We had wellness built in. Now let's fast forward to today.
Yeah.
The
Yeah.
video games, the social media and its impact. The world, just in general, is different. I remember the 80s and 90s because it was good times. I mean, your president played the saxophone, things like
Yes. Yes.
and I mean, I'm a teen at that time, and that's what I see. I don't see the other things that are going on, but I just see such a good time. And I feel like today there are no boundaries, and we're scrambling trying to put together
Right.
the boundaries we need to be healthy and well again. Oh, and you grew up in the community that you lived in. Everybody grew up and knew everybody. But now our families
Yeah.
are scattered all across the world. So you have to build micro families wherever you land. And sometimes that can
It's
be
true.
challenging. So,
It's
Can I
true.
ask a question then? Because
yeah.
you're making you're making a whole lot of sense to me, and I think given all the screens, given the video games, everything we know that's happening this day and age, I think we're setting the stage for both ADHD, which we now know the DSM says is a spectrum, so we're all on it, but also addictions. If you've got the predisposition, I think it's just
Right.
so much more likely that you'll express. But anyway, awareness is key,
Exactly.
right? Families need to look at their behavior and ask themselves collectively if they've got somebody who's dealing with an overt addiction. Am I helping this person? Am I helping them heal? Am I keeping them comfortable in their addiction? Am I the enabler? So I'm asking you this, Dr. Smith: is it about tough love and setting these boundaries as you're describing, and encouraging this to seek support before they enter what stage? What are the signals? How are we? Because I did this with my own sister who had the addiction problem. I was fully the enabler, to the point where at 3 a.m. I was down at the precinct picking her up again, or at the
Mm-hmm.
Blockbuster. Talk about a 90s phenomenon. Her drug of choice, go figure, and she's public with it, so it's fine that I'm saying this outright, was GHB, the date rape drug. She was masking her abuse as a child with this date rape drug. She'd pass out all over the city, and I was, I'd get a
Taking care
call,
of.
and it would be the latest pickup any day of the, a week, any hour of the night.
Right.
Should I have been doing something
Mm.
differently? Should I have been setting harsher boundaries? Should I, what is one to do? It's such, you love somebody, so you
You're
want to
Yes.
also
support
the
them any way
brother,
you
not
want.
the parent,
Right.
though. That's the other piece to remember. Because
Right.
I hear you blaming yourself. I'm not a doctor,
Yeah.
obviously, but
Yeah.
just as your friend, you're a brother, right?
Right.
Right.
That's different. Setting back. Sorry, Dr. Smith, you go.
You're
Oh,
you're 100% right. I mean, we're here, we're people, and we feel and we love, and we just
mhm.
want to be there for them. And that's all that you did. You led with love. And that's what's the hard part is the love. And sometimes we have to be what we would consider cold and tough at times. So it's not that we should beat ourselves up. It was done with love. But when we are get that awareness, when that divinity hits us and says, you know what, you got to stop doing this, you got to respond to that. You got to say, you know what, I'm feeling in my spirit something ain't right. I feel in my spirit there's something I can do different. Take some time and dig into that as the loved one of someone, because you're just leading with love. You just care, and you're not faulted for that. But you have to pay attention to your gut and your intuition that tells you something's got to give, something's got to change. And ask yourself, am I strong enough to be that person to help in that change?
So my question then, this just comes to me. Then would it not be a good idea? I mean, I'm getting the testing done for my kids. Would
Hmm.
it not be, as a parent, a good idea to get your children tested so that I know what you're predisposed to, so that I know my youngest is different from my oldest, and how I may communicate or how I may parent will be very different? Wouldn't that be a fantastic parenting tool?
I love that. I'm going to give this to Bryce, but I just reviewed some of the training from DNA 360, and they were just talking about how, you can be misaligned, and how, I think it's Kashif is how you say his name.
Yep,
And
you
he
got
was
it.
talking about how he did that for his kids, and he could work with his kids differently based on that and get good results. And
Mm.
that you guys utilize the DNA test in regards to your staffing and making sure that everybody's properly aligned with those things that work best with them. Bryce?
Beautiful.
I'll just say, we have this sort of cute analogy at the DNA company where we call this report that comes from the DNA 360. And if we have time, we should get into the pharmacogenomics side, because that plays a huge role here, and it's very
We
empowering
want
for
to talk
folks
about that
because we
too.
don't want, yeah.
Yes.
So when it
Really.
comes to the DNA 360, really what we're looking at is, a playbook. That's what we call it. It's your instruction manual.
Hmm.
And there's no need to wait until you're an adult age and you have full autonomy over your decisions to decide maybe what your risk for cardiovascular disease is and how you might want to control your diet, or know and learn what kind of exercise is the best for you. This instruction manual is available day one, as soon as the human can provide a saliva specimen, which is essentially day one. So there is no better time than to learn your child as soon as you can get a saliva sample. Because here's the thing, and I've translated to my children, and it's been incredibly empowering,
Really.
especially with my daughter. Oh, yeah, and I'll tell you stories. But as a clinician, one of our reports, and we have many reports, 30 plus reports, siloed into these different things. But the one I'm sort of most intrigued by and empowered by often when I'm dealing with my patients is our executive function, mood, and behavior report. Because I now,
This.
with this information, know how to approach my patient. I know how to talk to them. I know what they're maybe ready for. I know if I got to go fast, if I got to slow it down. I know how to
Imagine what that
gauge
would
their.
be for your child
Imagine for your
to help
child or
with their
family
mental
member
health
who's
and
suffering.
wellness.
Bingo, right? And so it's an instruction manual, and the stories are endless with my daughter, who just happens to be of an executive function, mood, and behavior, the type of child who is often caught as deer in headlights, is not
Right.
necessarily as emotionally regulated as my son, has in
Okay.
a hamster wheel, we call this, effect, but she ruminates and is very
Yeah.
sensitive. And I used to be, well, I still am. I can't get rid of this. This is just me, part of my gene. I'm a yeller. But what I did
Are you?
learn about, I'm a
Wait a
yeller.
minute.
Well,
Stop the bus.
yeah,
I
I
learned
know.
something. Dr.
Not a
Smith, I was growing
swearer,
up
but just a
and I
yeller, like yeah,
every day. You're a yeller?
yeller.
See,
I
that would
mean,
shut me down as a child. As soon as someone yells, I literally disappear.
so my son is like, whatever, dad, I hear you yell all the time. My daughter is stunned and very upset and emotionally traumatized. So I learned that,
Wow.
and I, learned probably brought it down at least 80%, right? So I mean, I can't change who I am, but nonetheless, anyway. And I don't mean chronically. I'm just mean that's when I
I
hit
know
my
what you
limit,
mean.
I yell. So, but
Yes.
addiction, substance abuse, and mental illness, these are all influenced by executive mood and behavior and this complex interplay of how genetic factors shape our brain from early ages and process mood, reward, stress, and so there's just a few I'll unpack. I don't want to get into the nitty gritty, nuanced detail, but there's just a few. Dr. Smith did a very great job a minute ago, very eloquent description. I'm going to get a little bit more technical just for 2 seconds because it'll help people understand the power of this playbook they will have. So what we're talking about here is essentially regulation of neurotransmitters. So in our brain,
Mhm.
we've got these hormones, and they signal and they send thoughts. It's how we experience the world around us. It's how we experience emotion. It's how we have mood. And it's not all that. It's, there's a lot of interplay here, but couple of genes that we look at. One, first, most important perhaps, is the DRD2 gene. This gene controls dopamine and dopamine availability, essentially. And the dopamine
Remind
is
people
really,
what dopamine's responsible
yeah,
for. So someone's hearing
it's
this for the
the,
first time.
right. So it's the mood, or it's the feeling and sensation of pleasure, reward.
Yeah.
And even more than that, perhaps science is realizing motivation. So pleasure and reward is what it's known for. It's been typecast as pleasure, but it's probably a
Mhm.
little bit more, this concept of how I am motivated to do things. So people with reduced DRD2, it's a gene, receptor active. So nerves communicate in basically empty space. Believe it or not, they send chemicals and they catch and throw these chemicals. But when they're receiving or catching them, in the case of DRD2, this is a gene that dictates how many receptors or catchers do I have. And often people with less satisfaction from everyday activities have a lower or reduced DRD2 receptor activity. They drives them to seek out substances. Here's where I'm going to get bottom line about DRD2. Drives them to seek out for substances and things that are artificially going to boost their dopamine, like even
Okay.
alcohol,
That
opioids,
makes
right?
sense. Right.
Yeah, Vicodin in the case of Matthew. So
Right.
this makes them more susceptible to addiction, but you never look at one gene. We look at pathways, multitudes of genes that interplay together. So the other really important one is COMT. It's an acronym, COMT. It stands for catechol-methyltransferase. That regulates how quickly dopamine is broken down. So now it's being received. Now you might have few receptors. We just talked about that, or a
Mhm.
lot of receptors. You're easily, emotionally, you're easily satisfied. So, but if you have few, more likely toward addiction. Now, COMT is how fast it's going to uncouple or break down
Okay.
dopamine. Okay. So with a fast comp variant, you clear dopamine too quickly. So there's variations on this. It could be average speed, it could be too fast, it could be slow, but this leads to a lower baseline of dopamine in the first place. So this results in impulsivity, risk-taking behaviors. You're always, Dr. Smith said this a few minutes ago, you're just looking for your next hit, to paraphrase, right? So it makes it harder to resist substances, and basically always looking to elevate, although albeit temporary because of your genes, you're looking to elevate dopamine. Now, just like in the Charlie Engle story, you can change the focus. you can bring, and this is the good news story, with some help and guidance from people that are in functional psychiatry, like Dr. Smith, you can bring them from a substance into the
That's
positive,
that's what I was
right?
going to say. How do you do that? How do you take someone who has that predisposition and sort of steer the bus over here? How does that happen if they're on the verge of addiction, or maybe they're already in it?
And and before she even answers that, because that's the question I have for her as well, and I'm so intrigued about how she does this in her personal practice, certainly well beyond aromatherapy. There's so
Mhm.
many tools in her toolbox. Just two other genes that I'd want to focus on: BDNF, brain-derived neurotrophic factor. BDNF is
Right.
crucial for plasticity, recovery. It influences basically how we adapt to stress and heal from trauma, emotional and physical. So you can be hit in the head like a football player and you can have problems here, or you can be emotionally traumatized. So low BDNF, low BDNF levels can hinder emotional resilience. So that makes it harder for people to overcome basically neurological damage or uncoupling that's caused by substance abuse or emotional trauma, right? That increases
Okay.
vulnerability to both addiction and depression. And then lastly, the genes
Wow.
responsible for serotonin. So we look at TPH2 and something called 5-HT-TLPR. These are together and separately how much serotonin we make and how good we are at recycling. So if you're not so great at the amount of serotonin, it's hard to be happy all the time. And if you're
Mhm.
not good at recycling it, which by the way also informs what kinds of drugs you might be taking, medical pharmaceutical drugs that best suit you. So imagine having, just the least amount of dopamine receptors, and when you get hit with dopamine, it's cleared quickly, and a low BDNF, which is going to cause you to sort of have, poorly adapt to stress and trauma recovery, very low serotonin. I don't blame anyone with that genetic aptitude that they're
So then what
going
do
to
you do
substances.
though?
What do you do? That's
Let's say you get that paperwork work, Dr. Smith, and Bryce says to me, Cheryl, this is your story. And I go, Dr. Smith, what am I doing? Where do people go?
Um, okay, I first start with just having a conversation with where does this person think that their fires are? And I'm authentically listening to the client. What is going on with you?
Mm,
So let's say, it's pain is the thing that's blaring out. They're acting out. They're seeking to numb it with vodka and other things, but pain is the number one thing. So I have to extinguish the fire that they feel is going on in their life first. And it's a tiered process. And then we start to bring in other aspects that we learn from the DNA test. Maybe now that we've extinguished the pain and now they're kind of more mobile and now they're open to some more things to help support them. Now we're going to bring in some supplementation to address some of the deficiencies, some of the ways that they work. Exercise improves BDNF, will get them moving more, those sorts of things. So we're going to
mm.
bring in lifestyle factors that are going to have a positive effect that may not even understand, but we know if you do this and do that and do that, we're increasing your emotional resilience. We're leveling your blood sugar so that, again, not having any emotional irregularities. We're going to slowly start to build them from behind while we're still working with what they believe is up front, some of the depression, some of the thought process and mindsets. And then we're slowly helping them change. So when you talk about how do you shift from all of these addictions to running, it's that initial conversation and rapport that you build with the client to hear what they like, what's important to them. What does a day in a life look like for you? What are your interests? I mean, getting to know your client. I have a client, he has an interest and the whole family is involved in weightlifting. And okay,
Mm.
and the issue is he's created a certain kind of habit of how he drinks. And so, okay, we now it's a behavior modification that helps you transition from one action to another. Um, and that's how you can kind of shift. But we're also making them feel healthy, making them feel motivated, giving the body what it needs. So now they have the energy. Now they're like, yeah, I could run. I want to do this next marathon. We're giving them, making sure they
Mhm.
have the brain chemistry, dealing with the um, brain chemistry so that now they're positive, they're motivated, and they can move forward. And slowly over time, you're just you're just creating this slow train that's bringing on more passengers to help it go faster and faster and be the best it can be. So that's kind of very vague, but everybody's so individual and personalized. It just kind of sounds like that. You start with the fire and then you start to bring in other, because I can't tell you everything. And we start to bring in the other components and help you move forward to get where you want to go.
Can I ask this? I mean, at least in my family, we have addiction is a thing. My
Hmm.
father's father was an alcoholic, and my
Hmm.
dad was, well, I think thanks to my mom, it was, she said, keep an eye on alcohol. Like, she was very astute and was very wise to what was happening. She saw things in that family. So my question is, how much does family history play in addiction versus genetics? And if you just have a family history of it, not just, but you have a family history of it, but your genes don't seem to pose a problem, is it a problem? Or does one outweigh the other?
I like to lend to Bryce on that one, but just generally speaking, he did just state not long ago that your genes could say something, but it doesn't mean that you have to have that something. And I see that to be
Right.
true in a lot of clients as well. But Bryce, will you further elaborate on that question?
No, I think that's exactly how I would answer that. Family history and genomics are not too different. I mean, they're almost one and the same. Family
Hmm.
history, the immediate family, anyways, is almost more of a study of the medical history. But genomics or genetics are only what they are because of your family, and of course, who comes together. So that is to say, we hear a lot about the skipping of generations of certain things. Not so
Mm.
accurate. For example, bipolar disorder or schizophrenia or schizoid, all these different diagnoses out of the DSM. What it is there's almost a luck of the draw, if you will. You're gonna have mom and dad come together. If one of dad's brothers and uncle has schizophrenia, that your chances are going to be higher, but doesn't mean you have to express it. That's
Mhm.
first. Second thing is you can have overt predisposition genetically to certain. We don't really the DNA company. Let's clarify something real quick here. We're not looking at cytogenetics or disease factors specifically. So we're not going to tell you that you're 1.32 times more likely to develop cystic fibrosis or, for that matter, schizophrenia. What we are saying is, given functional genomic pathways in mood behavior, as we loosely described, hormones, inflammation, detoxification, methylation, these very important biochemical pathways. We're going to let you know where there are suboptimal and, in many cases, optimal functioning of these. And then what do you need to do about the ones that are perhaps suboptimal? That's how we look at this. So a lot of these genes inform one's predisposition to addictions, mood behavior issues. But the good news is this: there's always there's no such thing as perfect, good, bad. It's just what you have. There's always something to do about it. The
Right.
plan, the action around what you do, which is through lifestyle, diet, supplementation in some cases, is very, very effective with, of course, the supervision and care of somebody like Dr. Smith. So all of that to say, genes don't even dictate necessarily exactly what one might. There's something called epigenetics. That's how the environment and all the things we're talking about influences your genes. That ultimately becomes who you are.
Mhm.
So from genes are not destiny.
Okay.
Genes, you can't change them. You can't modify, or you can't rather change your DNA, but you can modify genetic expression. That's the best news
Hmm.
of the day. And that's like recent of the last decade.
Wouldn't it be, and again, I'm just the one who asks a lot of questions, but wouldn't it be a really great thing if doctors had these tests available to see each of their patients, and to see if they're struggling with depression or they're struggling with anxiety, to see, wouldn't this be a really good thing for people to have, to be able to present to their family physician as a starting point, as a starting conversation?
I think that it's what you need to just really help to. I love to take all of this data, what I enjoy, and create the treatment plan for the client and
Right.
help put together that actual plan that is for them, that's going to help them get there. And that's what I love about the DNA 360 and other functional tests, because when you bring this in, I have everything I need. It's not just so in traditional psychiatry, you come in and you say you're sad, and then they give you the anti-sad pill. There isn't a test,
Right.
it's just that you said you were sad. Has it been more than 2 weeks? You don't, and it could be something just really crushing in your life, and you're on a medication, but you may not need that. But this gives me the plan. I know exactly what to do. It's not a guess. It's not a hypothesis. These are facts. And that's what I love about the DNA 360 and having these types of tests, because the guesswork is out and the facts are here. And now we know we can help you really get to your destination of optimal health.
Yeah. That's one of the things I never really understood. If you hurt your knee or you bump your knee, you're going to get an x-ray. If you hurt your ankle, you're going to go get an x-ray or an MRI, whatever. But when it comes to the brain and when it comes to mood, it's we don't take a look at the brain very often. I mean, there's people like Dr. Amen who are doing incredible studies and things on the brain that really help a lot of people. But I feel like a lot of it, when it comes with mental health, we're not looking deeper than, as you said, how are you feeling, what's going on.
Correct.
And it's just such an important piece because people are so complicated and there's such a
Hmm.
backstory. And that's what I hope, if anyone's listening here today and is feeling lonely, or they have a loved one who's feeling lonely, that they push for answers. They ask more questions. It's okay to ask questions. It's okay to advocate for your loved one and be like, this is not enough. That's what we want people to do. That is an important piece of family care, healthcare in general. That's something. Bryce, what role does genetics play in addiction, i.e., the variation of dopamine receptors and enzymes responsible for drug metabolism?
Yeah, no, I mentioned a few of them, and I'm happy to dive right back into that in a second. But
Yeah,
I'd love to just sort of support your notion there that Dr. Amen is one of these trailblazers. He's looking into the
yeah,
brain. He's done over 130 scans of the brain and sees the function. I would argue that genetic screening, that is to say, looking at one's DNA through the DNA 360, is actually an X-ray at the molecular level. I mean, it's
right.
really just looking into your DNA and seeing where am I predisposed to having various mood and behavior challenges.
Yeah,
I think that's the idea, and I think that most folks don't realize. Again, I'm just going to try to drive this home. There's no such thing as good or bad. There is just what you have, and in some instances, where you might have this gene is fast or this gene might be sort of suboptimal when it comes to mood behavior addictions. But guess what? It's a superhero gene when it comes to ideation or innovations or creation. So we know of a multitude of examples. US presidents is one example that comes to mind, where at least I could ramble off five that were bipolar. So what? More predisposed to depression. So what? They led the country and they were innovators. So there's
yeah,
no such thing as good or bad genes. But when it comes to these sort of, again, nuanced, how is DRD2 working, COMT, BDNF, TPH2, 5-HTTL-PR, all these different genes that control for the neurotransmitters for which sit around longer periods of time and or are swept away quicker. It's just, where are you on, to answer your question, where are you on that spectrum, given the particular emote or experience that that particular neurotransmitter might provide. And that's what we look at. And then, of course, to Dr. Smith's earlier description of how a functional psychiatrist would ultimately manage is, you're going to turn the dial with the toolbox that you have through diet, lifestyle, supplementation, emotional re-regulation, et cetera, either up or down on that neurotransmitter
Hmm.
pathway. Right, that's
right.
the idea. And again, this, we have to drive this message home as well, because this is not about hand holding. Of course, there's this setting the stage of what is best given your genetic aptitude and a proper medical history and proper medical intake. But this is participatory, right? So
Yeah.
this is not, this is, the individual has to be willing and ready. And, this whole idea around enabling and hand holding, we got to sort of have that conversation as well. We just, that's not the way to approach somebody who's suffering. They have to be willing and ready and participate in their recovery, correct?
I love that. I say that all the time. It's about being willing and able at the end of the day. So when you're talking about addiction, that's first and foremost. You know, do you want to be sober, really? And are you willing and able to do the work? Those are the questions that need to be addressed when it comes to addiction. I wanted to give an example in just from a mental health perspective and how the DNA 360 was so profound in someone's life. And I had a client come to me and he said, you know what, my dad just got diagnosed with ADHD. I think I have ADHD. I can't focus. I can't keep on task. I can't sleep. So I'm just ready to be put on the medication. I know I have it. I'm like, wait a
Wow.
minute, wait a minute. Let's go ahead and let's do the DNA test. Let's take a look and see what's really going on. And his issues were not a mental health issue. He actually was not clearing. He couldn't detoxify well enough. He had a liver and gut issue. And so, what is so profound is that he was saved a lifetime of being on stimulants, adding more medications, adjusting dosages, trying to get it right so he could focus. And the beauty of the test
Wow.
allowed us to get right to the root cause. Because in mental health, a lot of these symptoms, well, diagnoses are symptoms just telling us there's more we need to look for. And in that instance,
Yes.
Yeah.
just think about the journey that people go through with medication. Because then you get on
Yes.
one, now you need to add two or three more because you can't sleep, you don't have an appetite. Then you're raising the doses up, down. Let's try it, swap it out, and try something new. He didn't have to go through none of that. Now he knows.
Even when we go into pharmacogenomics, is that right,
You got
Bryce?
it.
Yes.
Pharmacogenomics. Well,
I was just
and this is
sweating.
a perfect
Just
segue into that because once you've got all the detox issues ruled out or in, that's the whole point. Are they having problems with detoxification or not? Are they having problems with methylation or not? Both of these siloed pathway, genomic pathway, gene-driven outcomes are huge players, to Dr. Smith's point, for mental health dysfunction and addictions. So once they're ruled in or out, and you address them or you move on, um, to come to this pharmacogenomic discussion, now there's no
Can you
question as
explain
to
what that
if,
is, first of all, for people who are
sure.
listening?
So
They're
if
like,
you need
what
a
is that one?
medication,
Yeah.
yes, we, just to reiterate, never do anything before speaking to your pharmacist, doctor, healthcare provider. No, change anything, stop anything. You need to be properly guided. So whatever we might have said on this podcast to this point, or we will say, is for your information only and not to be interpreted as medical advice. But having said all that, pharmacogenomics is the analysis of genes, just like we've been talking about, but basically that provide very specific, actionable insights into how an individual's genetic makeup affects their response to medications or drugs. And we're not against drugs. No one in this panel is. No one at the DNA company is against
No,
drugs if and when
no.
it's properly indicated. And what better way to properly indicate it is to try everything else first: first line therapy, diet, lifestyle, supplementation, genetically informed,
Right.
and then, if needed, a drug.
Hmm.
The report of a pharmacogenomics report is designed to help a physician, clinician, somebody like Dr. Smith, like myself, optimize the treatment plan by basically understanding how certain genes influence detoxification of the drug. So it's the drug metabolism, we call it, the efficacy, and even potential side effects. So some people with certain. So here's how it works, right? So DNA analysis, the patient's spit is sent to a lab, and that genetic data is interpreted, which correlates, by the way, directly with the findings of the FDA approved pharmacogenetic guidance, or educational insights, where these official guidance is otherwise lacking. Then you get metabolizer status. So these actionable insights basically are what status are you to metabolize these drugs? Are you normal, intermediate, or are you a terrible metabolizer for this drug, in which case it's contraindicated?
Right.
Then there's potential risks of adverse drug reactions. Are you going to have a bad reaction to this? Bottom line. Then there's the drug to drug interactions, like how genetically, if you're on more than one, and often people are. And there's that, again, as I mentioned, the FDA pharmacogenomics guidance on these medications. So the key features are as follows: gene information, medication guidance, and regimen risk summary. Those are really what we're getting out based on you and what drugs are okay for you and what drugs are not okay for
And
you.
I feel like this is so important and Captain Obvious. I hate to say that. I feel like this is something that should be everywhere. My mom has MS, and there was a time when she was on XYZ medications, and things weren't going well. And had we had I think, and this is just me, had we had a test like that, I think it got very scary there very fast for a while. um, Things would have been different. Even me as a child, there was a medication that I was put on. Um, Only through my body reaction were we able to discover that I was highly allergic to it. and it was a really dangerous situation. Obviously, things are fine, but those are the sorts of things that would be very, very helpful to understand
Hmm.
for your children, for your parents, especially as people get older. And there are more medications sometimes that are needed as someone ages. So this is
Right.
where, for me, at the beginning of life and even at the end of life, geez, those are really important pieces to know, I think.
Oh, but personalized medication. I mean, if you need drugs, it's, reducing side effects, faster results. What more
Right.
could you ask for personalized N of one? And by the way, for addictions, specific to the topic of our conversation, it can basically identify genetic factors that make you more vulnerable to dependence
Hmm.
or show
Wouldn't
you
that
how,
be wonderful to know?
right? Or show
Yeah.
you how your body will handle addiction medications like methadone or
Hmm.
Suboxone or any of these things. And then for
Why
mental
isn't
health,
this? Can I ask another
yeah.
Captain Obvious question then? Why wouldn't this be something that would be available to all hospitals before people are treated?
I mean, more and more it is. That's the good news. I mean, we're getting the
Okay, good.
message out there with
I
excellent
just feel
doctors like
like,
Dr. Smith, but that's the point.
right? You could save a lot of lives. This would save a lot of time, I would think as well. And then the more you know about the body, the more you know.
Right. Right. Have you used, by the way, the pharmacogenomics? Because I mean, DNA 360
Hmm.
tells us a lot. And by the way, one of the things it tells us is, believe it or not, 25 to 50. It's a huge number. Almost half, 25 to 50% of individuals. You can find this out from DNA 360 have genetic contraindications for the most prescribed antidepressant drug on the market. I don't care which one you use, there's dozens, but what the classification is SSRI or serotonin reuptake inhibitor, selective.
Hmm.
SSRIs are contraindicated, we find in 25 to 50% of individuals with this particular gene. So are you seeing that helpful, Dr. Smith, in your practice where you're able
Yes.
to sort of help guide maybe somebody into pharmacogenomic assessment? Yeah.
Yes, it's 100% effective because what we're taught is just an algorithm, like if you like based on how your depression presents, you give these medications, or maybe if you have pain and it's an antidepressant, you'll use this medication. But to say, okay, citalopram is not going to be cleared by your body in an effective way, we can't go that route before you take it and we fail and you're constantly suffering for another month or two. It saves
Right.
time and help people get to where they need to be quicker. So I love these reports because it really streamlines and gets you where you want to go sooner than a trial and error scenario. And that's what you want to eliminate. You're losing your life by doing trials and errors. You can be at your best life sooner by using these tests to help you get there quicker.
Beautifully said. I mean, we're preventing overdose and death, and often that's negligence in very few in cases with doctors. But this is one of the number one killers of people is doctors prescribing the wrong or too much medication, and we can solve that. That's the bottom line, and that's very empowering. It's about improving overall health outcomes, yes, but when we know how a person's body is processing medication,
Yeah.
drugs, which is the number one killer of North Americans when it's improperly prescribed, we can change the script here. The narrative can become, we can create a treatment plan that truly supports their recovery rather than
Hmm.
adding to their struggle.
Yeah.
Bottom line.
I think
Correct.
that the whole purpose of this particular podcast is knowledge is power, and understanding that by sharing a story, Matthew tried so hard to share his story. He did it in his book that he shared, in the rehab facility that he created for others. His legacy will live on through laughter and joy, but also a really important conversation about depression and addiction, and how his incredible family has worked so hard. So I'm glad we talked about all of these things today. I think they're so important. Dr. Smith, for opening up and sharing your story and your insights, and even you, Bryce, sharing all the stories that I didn't know about. I think it's so hard to open up about things like that, but I know that there will be someone here today who heard these stories, and this will resonate and potentially save someone's life. So I think it's really, really special. I really
Well,
do.
and you too, Cheryl. And and then
Yeah.
we didn't plan any of it. And here's the thing. I think part of the message is we all have a story. Most of us have
Correct.
a story, has a story that's closer to home than, we necessarily imagine. So
Yeah.
this is part of also the idea of like just Let's talk about it. Let's continue to have the conversation. Let's be open about it. The brain is another organ. It might be what guides, our thoughts and our consciousness. And I don't want to get ethereal about this, but the idea is that we don't often revere it as an organ that often needs its own
Oh,
focused care and attention,
we need
right?
to.
And
Yeah. And we also know we want to bring back the 90s, right, Dr. Smith?
Oh, that's right. Right? We have to
Yes,
do it
we
all in our
do.
own individual lives, but we can bring it back in our
Yes,
own way. Yeah.
for sure. So, where can people reach you? What website could they visit to learn more about you and the work that you do?
Yeah, you can go to wellness.vegas and you can find me there. I am on Instagram and Facebook and LinkedIn, and you can put in Dr. Tiffany M. Smith to find me. On Instagram, it's Dr. period Tiffany M. Smith. But you put that anywhere and you'll
Amazing.
find me. Yeah.
Ah, that's fantastic. Well, we'd like to thank you all for tuning in today to the DNA Talks podcast. If you wish to get yourself a test kit, make sure you use my code, because now I have a code at Cheryl H for a discount. This was fantastic. Thank you so much.
thanks
Thank you for having
everybody
me.
for joining us on the DNA podcast. And also, if you found this conversation helpful, obviously, please remember to subscribe. We have so many of them coming down the pipe. Leave a review. We love to hear from you. And of course, share it with others who might benefit. And there are many who can benefit from this conversation today. And don't forget to follow us on Instagram at the DNA or
Oh,
at
yeah.
DNA Talks Podcast or at the DNA Co. For more insights. And remember, help is always available by calling the crisis helpline at 988. And we will see you next time. Thanks, Dr. Smith.
Thank you so much.